Hello and welcome to Borno Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the leadership of Professor Baba Malam Gana, the Commissioner of Health and Human Services, Borno State. Given his extensive experience in the healthcare sector and his background working in European countries for decades, Professor Baba Malam Gana has been working to reform and modernize the healthcare system of Borno State since becoming commissioner. One of the innovations brought into the healthcare system was the electronic health record, EHR. The commissioner further explained the significance of such initiatives.
The digitizing of hospitals is crucial in the modern context of healthcare, and this by global international best practice. This is what happens in most developed countries and even medium to low income countries of the world, where processes within hospitals are digitized, and therefore it brings about efficiency and also brings about improved patient care. And that is what led us here in Borno State to look into this, and we were able to commence the digitization of our healthcare facilities in Borno State. We have looked into digitizing of a primary healthcare center, which is called 1000 Estate Primary Healthcare Center. You're welcome to visit the health center and see for yourselves how it has impacted on healthcare within that facility. And we are also currently digitizing the State Specialist Hospital. It's a massive healthcare facility, and we have picked up certain departments to digitize and demonstrate what it means to have a digitized system, so that the staff in the hospitals and beyond will recognize the importance of digitization, and therefore then we can go into phase 2 where we can expand the process.
Professor Baba Malam Gana emphasized that when the electronic health record are utilized properly, he can monitor the number of patients visiting all the health facilities, the movement of drugs and other services from the comfort of his office.
That staff so far, for example, in the 2 healthcare facilities, are very happy to see that digitization has come in. For example, one example to give, an antenatal clinics, they have difficulty in finding out which are the women that have not turned up for antenatal care. They used to have CAT system, but now it's very easy on the computer. The computer will bring up those who are supposed to attend, and if they don't turn up, then it's very easy to recognize these people have not turned up, and therefore they can be contacted either through telephone or some of the health workers who are assigned to go to their respective homes and find out if all is well with them. Also, having said that, digitization also enhances. For example, you can transmit certain information, like data collection can easily be done within the hospital. You can see on the screen how many patients have attended today, and also you can see how many patients have paid and how many have gone to pharmacy, what drugs they've been given to them, etc., etc. This brings about efficiency within the system. And also you can transmit, for example, CT scan or MRI. You can send it to doctors in their offices who can see, or to the outpatient department. They can be able to open up and see using the what we call as PAC system, whereby they can be able to read the images and they can read the reports on these images. And by so doing, then you don't have to wait for 3 or 4 days until these things are processed. It's almost instantly. And it also gives us the advantage, can also access some of the information right here in my office so that I can see what is going on and I keep an eye on the situation. And to extend it further, we're going to link it up to our Drugs and Medical Consumables Agency, which is in charge of all the pharmacies in the hospitals. And these hospitals can order medications from the drugs and medical supply without physically going there. They can order it on the system, and these drugs can then be made available to them. So there are a lot of advantages, and I can also have access to the system and see about the drugs, what's going on, seeing what is happening in our regional stores that we're going to create, etc., etc. So the huge importance of digitization, which the council, the executive council, has now given its consent that this.
Commissioner of Health, Professor Baba Malam Gana, giving an update on the new introduced electronics health record (EHR) to the healthcare system of the state. Moving forward, Dr. Austin Okogun, the head of the company responsible for digitalization of 1,000 PHC, explained how this process works and the impact it has on the healthcare sector.
All right, what we are doing at the moment is a pilot because we need to prove the concept that it works. So we have completed the automation of the 1,000 PHC, and at the 1,000 PHC, we have moved them from a paper-based practice to a paperless practice. There, we don't need to move files around anymore. Patient records are completely automated. Patient attendance, consultation, registration, drug dispensation, all that are automated. So what happens now is that it's shown where people come to the hospital and have to carry their cars about. No more. Identification of patients is also better because the risk of using somebody else's file for another person is ruled out because we can see your photograph on the screen if we need to, or your biometric, or use your phone numbers to differentiate you. Like I told you, if your name is Maman, you have 3 Mamans from the same community, living on the same street, coming to the same hospital. It can be confusing. Maman and Ubaka, all of them. How do you differentiate them? Their phone numbers. You know that this person is different from this person. And when you come for the first time, they take all the details from you, your height, your weight, everything into the system. And even the system will calculate your body mass index, your all those things automatically. It's all there. So when you come to the hospital, and you are Mama Abubakar, you need to call your phone number, they know which one, and then it goes. So your time you stay at the reception for them to look for your file at the card room is gone. Click, you go. The same thing at the vital signs and consultation, everything is automated. All your health records from the past 3-4 years going forward are going to be in the system. And the doctor can browse them within a short time to see all your attendance to the hospital, your medications, everything is there. Your lab results and everything. They can see a trend or whether you're getting better, getting worse. That's for the customer and for the doctor. Now, for the people like the Honorable Commissioner and the directors of the healthcare system, they can see the health records on their dashboard on the go. You get it? So every day, the Honorable Commissioner can sit down here and say, I want to see how many people have gone to 1,000 PHC. He will see. I want to see how many deliveries they have done this month. He will see. Click. I want to see how many men have gone there this month. He will see. I want to see how many children have gone there. He's just here. Doesn't need to go anywhere. He doesn't make any phone call, nothing. That is very commendable, completely commendable. I mean, this is something that is needed by every state, every part of the country. I mean, you can imagine how it is if every hospital in Borno State is like 1,000 PHC. You can imagine that. So you can imagine that a patient leaves 1,000 PHC and refer to SSH, and from there refer to teaching hospital. You can see all the file by yourself. So it's beautiful. And again, more importantly, that apart from saving time, you save money. You can track all the draws coming in, how they go. You can track all the money coming in from the customer to where it is banked. You can see everything. So it's going to help to cut down wastage. It's going to help to improve record keeping. It's going to help the auditors to do their audits, both on the clinical quality side and on the business side. It's going to help the centers to save more money, improve their IGRO. It has a lot of benefits. At the end of the day, the most important thing, which is access to data, for decision making and for patient care is going to be completely optimized.
The deputy head of the 1,000 housing PHC, Hajjazara Mala, and other officials delightfully explain how the electronic health record system works, make their work easier, and applauded the ministry's efforts towards digitalization of the facility.
Very happy with the state government for providing us with the digital computer. Before we were using register papers and biro to do our work, but now everything is digital from OPD, that is record room, to the triage, from triage to the lab, from lab, all the units where it's possible before it will come back to where the patient come, like ANC. So we are even very happy because we are now in the new system. I'm very thankful for the Borno State government, more especially the commissioners, for choosing 1,000 estate to start using computer system. And we are looking more for any project to land in our clinic.
Before, we are capturing the data in a paper system, but now we are on computer system. Before, we are using paper and pen, and we are suffering because there are a lot of job here. We are tracing, we are doing filing, then we are also registering new patients. But for now, only for registration in the computer system. We are just doing it inside computer. When the patient comes for follow-up, we are going to just put the card number of that patient inside the computer. Then the computer will only bring that information of that person inside the computer, and when we'll send it directly from the record unit to triage. But before, if the patient come, either for follow-up or new registration, if for the patient is come for the visit for follow-up, we are going to collect that card, then we are going to trace it, we are going to use the number one by one. Even if we didn't get the number exactly, we are going to use one by one. We are going to use the 100. We are tidying 100 cards each. We are using number from 0, 001 to 100. Then we are changing it year after year. If the year comes to end, we are going to change another number and use another number. Same number, different year. But if the patient has complete card number and year, we are going to trace that patient and remove the card. Then from here, we are going to also register it inside general attendance register. Then we are going to take that person to triage. But now, if the patient come in, we are going to just use it. If the patient is new, we are going to register it and just send it to triage without we going there. I think this one is easier now. So we are now digitalized and we are enjoying using it.
Gaskiya alhamdulillah, tsari dai yayi kyau. Da muna shan wahala, zai kasance ma a cikin unit din mu 3-4 ne. Amma yanzu da computer ya zo, duka mutum ɗaya ma zai iya yi. So zaka iya ka yi allura ka zo ka sa datanka a cikin computer. So ba mu da matsala, kuma ba ma samun matsalan da a ce wai tikle ya bata. So the more mata in ta zo, in muka yi allura, in muna sa number, shikenan zai fitar mana da suna. Ba mu da matsala. Gaskiya yanzu ko da mace in ta zo, in muka ce yanzu fenta kaza ne, wa'ensu tun ba ma fenta ne suke tsoro ba, za su iya su ci ai sirga sun gama fentan su suna na 9 months. Amma the more muka shiga record, za mu iya mu gane a ina ne ta saya. To wannan ma ci gaba ne. Gaskiya alhamdulillah, ba abin da za mu cewa gwamnan Borno illa Allah ya saka mishi da alheri, Allah ya bashi abin da yake nemo da Ministry of Health. Gaskiya kam mu a Borno kam 1000 da kan gaskiya mun ji dadin shi. don ba dan komai ba ma a cikin Borno State mu ne aka fara bawa computer, so ba abin da za mu ce illa godiya za mu yi.
Yes, that computer
You can learn
us in so many ways, and the work is very easier for us now before. It is easier and understandable. When they send a patient in clinician, they will come with, he or she will come with his hand card, and we will put the patient card number and see the drugs that prescribed by the clinician and dispense it.
Mun samu ci gaba sosai a asibiti, amma ya kawai matsalar daya ne kawai shine kuma wuta ne kuma inda sun samu ne a hada mana da farko dai bayanai a patient ya zo daga zai saya mara lafiya ya zo zai saya daga medical record ne. Medical record za a yi registration kuma za a tura shi triage ne, which is observation room. Bayan observation room za a tura clinician direct zai tura ma lab ne. Mun gama za mu tura clinician kuma in ya rubuta maka zai tura pharmacy. Shine yanayin aiki.
They, however, appeal to government to repair their broke-down borehole and provide separate solar system for the digitalized computers.
The only problem is the problem with the light. Sometimes there is no NEPA. Sometimes the generator, they will say there is service problem. And we have solar system for the clinic. But when it is 2 o'clock or 4 o'clock, it will take off. We have issue of problem with the clinic solar. My request for the commissioner, if possible, let him fix different solar only for the system, so that even when there is no light, no generator, no gas, anything, our own system is different. There is no more load, so we can use it separately so that we can work. We can do our work.
Problem number one is light. So the computer system is not. We are not having lights properly. Sometimes NEPA, sometimes solar, and the solar is not working properly. So if we are recommending to have a solar system only for the computer, so from now we are going to have any problem. But now sometimes we are instead doing work, then the light will cut off, then we will stop doing it, and the patient are still waiting there. So they are even complaining that they are taking it that the problem is from us. So that thing is the major problem for us.
Of the patients in the hospital applauded government for upgrading healthcare facility in the state.
Da gaskiya idan an zo da kati din ana wahalar layi da kuma kamun abinci ko fayil naka ana shan wahala. Yanzu kuma da aka dawo da kwamfuta din gaskiya abin ya zo da sauki. Muna samun daɗi ga magani kyauta, allura kyauta, duk abin da za maka su test komai kyauta ake yi. Mutane da yawa daga wani wuri ma suna zuwa don sun ji daɗin shi. Sai dai Allah ya saka mishi da alkhairi da kuma al'umman primary health gaba ɗaya Allah ya saka da alkhairi, Allah ya biya su.
Well, viewers, with this, we have come to the end of this week's edition of Borno Health Update. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am Ibrahim Amarawa saying bye for now.